Welcome, everyone. This is Tammy Costrini from Insurance Advisors Direct. And today we have Michael Pyers and Sherry here from 𝗵𝗫𝗁. And we are going to be talking about ICHRA and the exciting new platform that we are bringing on, powered by 𝗵𝗫𝗁 for ICHRA. And so today we're going to overview ICHRA a little bit for those of you who may not be as familiar, but also it's really kind of the launch of our platform. So we're very, very excited to have you both with us today and to be officially launching this. I know we are constantly getting requests, so we're very, very excited. So ID's ICHRA is coming and changing the game, and we are very, very excited to found the partners that we found in 𝗵𝗫𝗁. If you are new to ICHRA, no problem. We are going to talk about that today. But just in short, ICHRA allows employers to set a fixed budget for health benefits, lets employees choose their own coverage, and replace traditional group plans with flexible and cost-controlled options. ICHRA is really equals freedom and predictability along with personalization. Why agents love ICHRAs? You will help employers set a budget and employees will customize their benefits. You get access to a robust marketplace of health and wellness options. There's less admin work, which means more time for you to grow your book of business. And you stay at the center of the relationship with tools and support designed for agents. This was very important to us, and why we did end up partnering with 𝗵𝗫𝗁 is we strongly believe that the agent should be in control of their book of business and the relationships that they have fostered through the years. So today we are introducing the ID Align ICHRA OS. It's a modern agent-centered ICHRA solution powered by 𝗵𝗫𝗁. And with that, Michael, I am going to go ahead and let you take charge.
Great. Thanks so much, Tammy. I appreciate it. Before I start sharing some screens, let me just do a quick introduction of myself. Michael Pyers. I am co-founder and CEO here at 𝗵𝗫𝗁 HR. And, we started back really with the foundation of this in 2020 when the legislation passed. And over the past several years, we've developed a platform, partnership and relationships with IAD and organizations similar to many of you on the phone to help you really be in the ICHRA business as it's continued to grow and flourish. So I'll be sharing some trends and some things here in a moment. Let me get my screens up. Hopefully I can share this and we can see. All right. Let me see if I can go here. Are we, can you just give me a quick thumbs up if we're seeing the slideshow or you're seeing the PowerPoint slides? Okay.
Yes, we are.
Okay, great. All right. So we'll go over a little bit of the landscape. We'll talk a little bit about, everybody's heard about, obviously government's in shutdown right now. Lots of concerns around what's happening there. We won't get too much into that because it's such a moving target, but prior to that, there was the BBB or Big Beautiful Bill, and there's been some shifts in the market. So we'll talk a little bit about that. We'll do a platform overview today of what the platform is, both from the administrative side, some of the tools and capabilities at a high level, as well as a glimpse into what the user experience is for an employee or a member when they're shopping. And then we'll have some time for some Q&A. I believe there are some tools that you can submit your questions and we can answer them towards the end. So just some foundational, looks like it's wanting to go through some automations. Forgive me. Some foundational data. This was a stat that actually came back in 2021, but we've been referencing it ever since. And what's kind of scary is how predictable this data was, right? So at the time, going back almost 5 years now, it was found that 87% of employers were concerned that within 5 to 10 years, insurance, health insurance benefits would be unaffordable for to employees. Well, it's probably not that ironic then that 5 years-ish later, we're sitting here with a government shutdown. We're all looking at some of the highest potential rate increases that we've seen in historic standards. So it's interesting how this, indication was already showing up already 5+ years ago. When you think about the ICHRA, this legislation um, was passed, for those that don't know, was passed in January of 2020. It was actually passed in 2019, but actually effective in January of 2020. But if you think about it, it was the first time that in 75 years at that time that there was this alternative pre-tax opportunity for how to get benefits, and individual coverage health reimbursement arrangements was born, or ICHRA. Great acronym. Everybody loves it. It's so easy to say and remember. But in all jokes aside, it's been a really tremendous game changer for the industry. Early on, there were definitely some headwinds. People didn't really know. One, didn't know about it. Two, didn't know if it would, it would exist long term. You got to remember January 2020. 2 months later, we went into a global shutdown with the pandemic and COVID. So that first year, we didn't see a lot of things happening with COVID being there really in top of mind. But when you think about how ICHRA has evolved since, it's pretty incredible. It did open up the floodgates um, for sorry, I must have some timing in these. I didn't realize. I apologize. So it opened up the floodgates, and what it does is it allows people to move towards having individual choice. So the way to think about an ICHRA is, if you think about a traditional group plan as an alternative, an employer would set up a plan and give some options. And let's say that employee is going to have a plan that costs $750 a month, for a simple example, and the employer is going to contribute $600. That means the employee is contributing 150. What happens is it shifts the control with an ICHRA. It goes from a defined benefit like a traditional plan to a defined contribution. You take that same $600, and now the employee decides how to spend it. And that means they can spend it not only on their major health coverage, but if they are able to buy coverage that's suitable for them, because everyone's personal, right? Individual. My situation is different than others on the phone, and so on and so forth. I can maybe find a plan that's suitable for me for, say, 400, and I can take the balance potentially of that 200 if allowable, and I could spend it on other things that are important to me in my benefits. I can also use it for my out-of-pocket expenses. And I'm now plus 150 in terms of out of pocket, because I'm using only the employer contribution, and the employer's fixing their budget. So they're no longer sitting there with this variability of, I'm forced into a X% increase. I can look at inflationary rates. I can look at other things of how I'm going to increase my contributions. So the strategy is very flexible for employers and for employees. And that's why it's become so popular. It really allows employees to have personal choice, employers to get out of the middle of trying to make a decision and really just focus on how much am I able to or willing to give to my employees to spend. And we have tools to help do that, which we can talk about. When we look at kind of the industry as a whole, it's been incredible, the trajectory of this. And these are some stats from the HRA Council, which has reports they do every year. This is one of the from their most recent report that brings you through 2025. But you can see how there's continued compound growth year over year on ICHRAs, on their sister plan designs, which are these 𝗬𝗃s, which certain businesses can potentially qualify, which has different parameters, but same concept of more flexibility for employees. Large employers are moving to ICHRAs. We've seen Netflix move there, which is a massive global employer. They moved there for their U.S. workers. We've also seen state governments move and county governments move towards ICHRAs, which have large numbers of employees. Many of these have been traditionally self or level funded type of plans, and they've realized that moving to an ICHRA was to the benefit of the workforce. And you can see that there's some that just have not offered coverage in the past because of affordability issues that now can offer an ICHRA. If you're under 50 employees and you're not an applicable large employer, and under the ACA are not required to meet affordability standards, you can put an ICHRA in place that gives tax advantage and give your employees $150. They're not going to buy health insurance necessarily with it, but they can use that same tax advantage money to go offset their expenses on their health insurance and buy a plan. They can also combine that with subsidized plans, assuming they're still available once the government comes out of lockdown, and which I think we're all assuming it's going to be the case. It just may change, and those things become really interesting ways to create flexible solutions. So lots of things you can do with ICHRA. It becomes that, as I noted earlier, catalyst to change. By itself, it's not a silver bullet. It is an incredible, I mean, the amount of savings that we've seen companies have is mind-blowing at times. I've literally had HR directors, VPs of HR crying on the phone because their employees were saving so much money personally that they took that like they were felt like a hero that they can have help these families and these individuals. And it doesn't always work, but 37 out of 50 states from our data, and is at or below rates that most groups can get unless they're the largest of the largest groups. So very, very, very compelling strategy. That being said, we are anticipating a rocky fourth quarter. We're already into it. Congratulations to all of you in getting started into what is going to be the madness of OE and Q4. We all go through it every year, and we know how difficult it is. We come out fine on the other side. This year is going to, throw some new things our way, right? We do anticipate there'll be a reduction in subsidies. I think generally, that is still obviously debate between those that actually get to decide this. But what we do think is going to happen, and why a lot of the rate increases, not only in the overall insurance markets, regardless of coverage models, but including ICHRA as well, have gone north from where they've been, is because there's an anticipation that we'll see a decrease in ACA participation. You'll have younger and healthier populations jumping out of insurance coverage altogether and going to alternative coverages, which we'll talk a little bit about. And there's, expected to be around 30%, which is pretty material. We're also looking at this and thinking that there's going to be clearly higher costs. So I think as a median right now, we're seeing something that's closer to it. It was proposed it would probably be around 18%. When we started looking at the data, the rates are coming out right now as we speak. Some states have published, some are ahead of it, but as we expect it all to be sort of fully baked and visible, in the next couple of weeks. And as we look at it right now, as we have sort of inside track to a lot of that, we're seeing that as probably closer to 10, 12%, which isn't amazing by any stretch of the imagination, but compared to what some of the renewals that I'm sure some of you on your phone have had to go to your employers with in a group, or what you're trying to figure out in a self-funded or level funded strategy model, we're seeing orders of magnitude greater than that. We've had people calling us 50, 60, 70% increases they're seeing on some of their groups, which is just mind blowing. 20, 30% seems to be very normal. So we think that this is a pretty attractive safe haven still, even with everyone being impacted. So it's sort of an interesting time. That being said, fourth quarter, this is the fourth consecutive year that we've seen increases across the markets, regardless of, again, model, and it is creating pressures on healthcare budgets, and everybody's feeling the pain of it. So you guys are all well aware of that. Some data on filings by state. I won't, obviously this is a bit of an eye test on the right-hand side specifically, but you can see how we've seen some big increases. However, if you compare them some of the group rates, and you look at still the fact that for most groups, they're seeing higher than these rates, it's still very attractive in most markets. Some other things that we are anticipating will happen. The legislation under the Big Beautiful Bill made some pretty important changes that we think are things that, if you're not already talking to your customers about, you should be, or you should be thinking about at least. And that is, one, HSA accounts are now available with bronze and catastrophic plans, not just high deductible health plans. So under the ACA and the off exchange plans, which are the ICHRA, there are many, many bronze. In fact, more carriers came out because of this, with even more bronze, expanded bronze, and catastrophic plan designs. But they now can be paired with an HSA. Why is that important? Because when you're trying to save money and you actually qualify for one of these plans, or it's suitable for you, it is a great way to save money. Some people don't care about wide networks. I know that's hard for a lot of folks to imagine, but they don't. They have their doctor is the same doctor down the street. Or they're pairing this with DPC, direct primary care, or what we're seeing with they're pairing it with other strategies like health sharing or some kind of a co-op, and they're using the catastrophic or the bronze basically to protect their downside. So there's all kinds of things happening in the market, and I think people are getting really smart. Self-funding has always been thought of as employers, but in many ways, there's individuals. I do it, that effectively self-fund through using strategies of how to, outsmart the markets with plan designs. And we can help you do that. IAD can help you do that. So we do see that with catastrophic plans, they're no longer restricted to only 30 and under. Any age, as long as you qualify for the hardship, and hardship can also include loss of your ICHRA coverage. So if you were moving employers and lost your ICHRA coverage, or you lost your subsidy, if there was a subsidized plan, you're no longer eligible for a subsidy. Those things can qualify you. Not giving legal advice here. I'm only sharing, limited what I know. So you should definitely look closely at it. But we see that happening. ACA affordability has gone up. So the tests in terms of to now just almost about 10%. So these are some changes that are impacting how strategies are being used. Some things that we think this means you should be watching out for. Number one, you're going to see employee costs go up. Most employers are freaking out about all this, and and how much their budget is impacted. They can only take so much of that increase themselves. So they're going to pass the difference on to the employee. The problem is the employees are often the ones that are already suffering from the high cost of healthcare, as we all know. So we're going to see more waivers. Again, this is a prediction. We could be wrong, but this is what we anticipate to happen. You're also going to see more people moving from that are even on ICHRAs, or where they chose a gold or silver plan in prior year, 2025, to now moving to a bronze or catastrophic plan because the costs are no longer feasible for the gold or silver plan. We're going to see more HSA plans because more carriers are introducing HSA plans, and for the reasons I mentioned earlier, because you'll see more bronze and catastrophics, which can now be paired with an HSA. We think that we're going to see, we know, I shouldn't say, we have many customers right now that are our prospects that have been moving in this direction where they're wanting to implement an ICHRA, but because it's, middle, almost late October now, they're setting the stage for the change. They're going to bite the bullet, so to speak, on a bad renewal in their current group plan, and they're going to do it only for a month or 2 months in some cases, because they're going to still save 11/12 or 10/12 of the costs for the year for themselves and their employees by switching. So they're not feeling the pressure to have to do it for 1/1 because you have special enrollment with ICHRA when you're coming off of a traditional plan design. And so that oftentimes they're using that as a strategy. So keep that in mind for something you can do with your groups, is guide them through the process here in Q4, but not sort of put them in, if they're not comfortable with the pressure of making the change, let them do the group renewal. And then in February or March, flip over to the ICHRA, get the bulk of the year of the savings, and everything that comes with it. And then we're going to see, I think, fee pressure this year. There's a lot of providers out there. If you have been in ICHRA and been working with any of these, they are brokers. Their model is different than ours in the sense that they will actually write the case. They own the BOR, they own the client relationship typically, and they charge the bulk of the fees. But we've seen fees that are pretty, and then there's got to be room for the sales broker on the other side, someone like say yourselves to make money. So what we're seeing is some of these fees are 60, 70, 90, $100 per employee per month. And if there's enough savings in year one, which is often the case, a lot of people don't question it. But when you get into year 2 or 3 of an ICHRA plan, all of a sudden it's a big sore, spot. And it's very, very obvious that that's excessive. And we believe that there's going to be some fee pressure that people are going to experience, which means opportunity for many of you to capture that business potentially.
So Michael,
Go ahead.
sorry to interrupt. I have a
Yeah, no,
question
go.
going back to that last slide on talking about the groups who may potentially switch to an ICHRA after 1/1. Is there any concern as far as if they had a 1/1 effective date of coming out of that traditional group into an ICHRA situation with their current carrier?
So, not there shouldn't be, right? I mean, so you're entitled to move to an ICHRA through what's called a special enrollment. You can do that anytime during the year. It is a first of the month renew or effective date for any plan, like a traditional coverage would be. But you could take a renewal, let's say from, I'm making up an example, Blue Cross in wherever state you are, for a group plan, and then implement an ICHRA for February or March 1st, and have your employees, or the group can have their employees go in, make their election. Some will choose a Blue Cross plan, but some will choose a Better plan or an Oscar plan, or a UHD, or UHC plan or whatever. So that's the whole point, is that there's a lot more options when you give it to the employees. They're not restricted to the pre-selected 2, 3, 4 options that might have been in the group plan design.
Hey, Mike.
Yeah.
This is Joe Markland there, you guys. I'm under Mike Pyers. I can answer. Having done post 1/1 renewals, I say that really the focus on going to an ICHRA on after 1/1 is because the 1/1 renewal was bad and they had to increase the employee contribution. The way we sell ICHRAs primarily is on how much is it costing the employees. So let's assume by moving to an ICHRA, the employees through choice could reduce an employee contribution from $200 to $100 because they're going to charge a higher deductible. Well, every month the employer waits is costing that employee $100. So if they move in February, it's going to cost them $1,100. If they move in, in March, it's cost $1,000. Every month they wait, it's costing money. So generally, the reasons employers have moved, if they're coming up group plan to individual, it is primarily based on the need to reduce the cost shifting onto an employee, and that has been the primary focus. So every month they wait, the employee's spending more than they otherwise would have had to pay, and that becomes the primary focus.
Great. Thanks, Joe. Appreciate it. So yeah, and I think I'll re-emphasize a point you said, which is just again one more time, which is take the employee's point of view and understand that they're feeling a different pain even than the employer. We've all been used to selling employers, and they're critical in this relationship. Clearly, they're the conduit to this. But the reason why employers are wanting to do this is they want their employees to have better options and hopefully save money. Employer's going to save money too. Everybody wins. But if you look at it only through the employer's eyes, sometimes it'll change the way you see things. So 2026 plan election considerations, talked about that already. So how are we responding? Couple things that we're doing, at 𝗏𝗡𝗏 with our partners, IAD, is we're integrating alternative healthcare options. So one of the things that we think is happening out there is, as you get younger, healthier populations out of the traditional plan, or as they move from, say, they were on a silver before because it was reasonably affordable, now they're saying, I'm going to go to a catastrophic with an HSA. Well, they can actually pair that with a strategy like a health sharing or a co-op plan. So we really believe, and we're seeing it happen already, that people are going to start moving in that direction. So we are the first and only platform we know of that has made it possible for you to essentially shop for all of those options in one place. Go and see what's available in the ICHRA markets. And if you make it available to the employer, or that you want to turn it on, they can go and shop for alternative plans like a health sharing plan and see what that plan costs us. And we're also seeing that people are going to be increasing use of not the HSA dollars to offset other out-of-pocket expenses, because now you have more plans that are eligible for it. So that means that we're going to see more partnerships, and we're, in our case, partnering with TPAs and HSA providers. You can also bring your own. And then there's as you move to an ICHRA, most, one thing to understand that's different is you're not enrolling the group in one carrier in the home state of the employer. Everything's based initially on that, but if the employer's in Georgia and an employee is in Florida, the employee is going to be enrolled in a plan in Florida. And in some cases, a broker may not be licensed and appointed in that state or carrier. So we have the support resources. IAD has the support resources that we can help make sure that employees are getting enrolled everywhere that they need to be. With the health sharing plans, we think that there's a few things to just sort of have in mind if you're not familiar with it. They're not insurance, but they provide coverage for your medical expenses. They do have some restrictions. Specifically, you can still buy a plan and be a member of a health share, but any pre-existing conditions are not going to be coverable charges or reimbursed charges. So you'll need your traditional insurance for those, but anything that's non-pre-existing can fall into a health share. They're definitely much lower cost. There are no networks. You can go to any doctor you want. Similar to deductible, they use what's called an initial unshareable amount, and then it's 100% covered after that. Essentially a community-based coverage, again, if you're not familiar. But for a lot of employees, this can be meaningful. And it can be paired, as I noted earlier, with an ICHRA to create a gap plan strategy. This is something that we've done ourselves here at enrichly, and you can take a lower cost plan like bronze or catastrophic, pair it with the help, the sharing, and then create a gap that allows you to ultimately reduce your total out-of-pocket expense, but still protect your max exposure. So really interesting things that are happening, and this is possible with that capability. So kind of touched on this, but I think it's important to go back to that employee point of view, right here, which is insurance is expensive and I have to do what's best for my family. You got to kind of keep that in mind. We have I think, a responsibility collectively that employees are trying ultimately to find the best option. And sometimes it may not be the one we think, because it's impossible for the employer or any of us to know every single unique situation that's happening for every single unique employee in their life. So having more options is better. You can kind of quickly see here that, if you look at, how big of a difference having a share plan in place versus a traditional plan, it's pretty meaningful. It's thousands of dollars potentially a year. This is from an actual analysis that we did where someone had a $1,000 deductible UPMC. Employees could go to this Sedera with DPC, direct primary care, and you could save the least amount of money here was $170. You had families saving $1,200 a year by doing that. So it can be very meaningful is the point here. Okay, so I'll pause right here for a second, see if there's any other follow or anything else you wanted me to clarify, Tammy, or based on anything that may have been asked on the call so far, and then I'll dive into a little bit of the technology for a quick glimpse.
Okay, we do have a couple of questions. One kind of is an offshoot of, I think, of just the health sharing and co-op is we are placing a lot of folks on indemnity plans that are adding up to almost a full coverage plan. Can those types of insurance be in the ICHRA mix? And I know we've spoken internally about this, but if you wouldn't mind giving an answer on that.
It's a great question, Joe. I want to defer to you on this one to see if your initial thoughts, but have you seen, or have we seen indemnity plans come into the mix on this?
I'll be honest with you. I haven't seen that. Okay, so yeah, there are people who are demanding higher plans, but when employees are given choice, they tend, I will say the insurance companies are modifying their plans to accommodate employers coming into the individual marketplace. So they're treating the individual marketplace a little different. They're making plans a little richer. They're adding PPO plans, trying to accommodate executives or people who've taken richer plans. That being said, we're not seeing that type of demand when employees are choosing. They're choosing based on cost. and even more highly compensated will take higher deductible plans, put money into an HSA. So I always look at ICHRA dollars as not just money to buy insurance, but it's to fund healthcare. You know, I'll give myself an example. I'm 63 years old. I buy Function Health, which is genetic testing to see if I'm predisposed to early forms of cancer. It's not covered by insurance. I do an alternative type of wellness program that's not covered by insurance. I have an alternative type of gym that's not covered. So all my health investment are things that are not covered by insurance. So I think people do, while the insurance industry is modifying plans to accommodate that type of buyer, the majority of the people want something different than that. Because keep in mind, the majority of the people, the healthiest 50% of our population, only spend $386 a year. So to overspend on insurance to pay for the first dollar coverage is a waste of premium to a certain degree. So while we see the change coming, we have not seen that type of demand when people actually choose plans, because now they have the ability to control their costs. You know, when you're choosing between 3 medical plans from an employer, then that may become an issue because you don't have the ability to control the cost. You're having to pay the premium that the employer has determined you have to pay. But it's different when people are spending their own money.
Okay. And she had a follow-up of these indemnities are up to 1 million on disability and accident, and then we fill in the middle with indemnity.
Yeah, so we're not seeing as much of that. We're seeing people putting money in HSAs. We are buying health sharing underneath, or for a broker that wants to offer some of that stuff. Yeah, we're as I said, we're finding them buying less insurance. That's kind of my point in general.
Right.
But those plans can be offered, and we're offering health sharing as kind of a gap plan. Buy the least expensive ACA plan and buy health sharing underneath if you don't have pre-existing conditions. But the people we see doing that are the companies who want to sell lots of voluntary products. But we're not seeing much of a demand on the employee side.
Okay. Well, I know, the market is always changing and everyone there has been, even since we started talking with you months ago, there's been, a lot of improvements in offerings in the platform. So I think that's something that, when you feel that it's appropriate, you will, add on. So we appreciate that. And I know the agents will too. Let's see, we have another question. It's kind of a two-part. One is, Joe, you touched on an approach to the employer for the 1/1 enrollment. How much is it costing the employee? So I don't know if you want to answer it, if you want me to answer it.
Yeah, what's the question specifically?
How much is it costing the employee if you were talking about the approach to the employer for the 1/1 enrollment? So the cost to the employee would depend on what the employer contribution would be
Yeah,
based on what they're choosing.
generally what we're seeing is when they're coming off a group plan that has been shopped in a few years or been shopped against other group, and sometimes that premium has gotten escalated 10, 20, 30% above the individual marketplace. So the employer spending the same budget of money, if the employer took the same amount of money and gave it to the employees by individually, in many cases, money's left over. So when there's savings on the table, if the employer decides to fix their budget, generally the employers are able to reduce their budget by taking that employer money and buying maybe a higher deductible plan. So sometimes the employer says, hey, there's 30% savings on the individual market. I'm going to reduce my contribution 30%. So it's all a function of the employer contribution. But generally, when we do that, we start with the idea of, okay, Mr. Employer, what are you spending today? And then what do you want to spend tomorrow? Which is why I say one of the viable options is to offer a health savings account. The employer should no longer look at that money, that contribution as just buying health insurance, but a way to fund health care. Because if you're healthy, buying a higher deductible and putting money to an HSA is a viable option. And if anyone is paying attention to the big, beautiful bill and what CMS is putting out, they made it easier to qualify for HSAs by not just requiring a high deductible health plan, but if you take a catastrophic plan or a bronze plan, you now are qualified to put money into an HSA.
Wonderful, thank you. And then Mary had a follow-up about the indemnity plans. Can they be set up on ICHRA? So those are not currently, as I think Joe may have already answered that they, indemnity plans are not on ICHRA at this point, so they wouldn't be able to be set up on it. And I think that was the last question.
Yeah, we're going to add the ability to buy other stuff. Okay. And whether it's an indemnity plan, an accident plan, a telehealth or direct primary care, or putting money into an HSA, the ability to take that money and buy other things. But, for a lot of things, it's not whether things could be sold or not. It's whether they can be purchased on a pre-tax basis versus post-tax basis. So under an ICHRA, the pre-tax needs to be an ACA eligible plan for the employee contributions bought off exchange in order for the employee contributions to be pre-tax.
Thank you.
So thank you. That's great questions. And so just going to show you quickly a little bit of what the employees see when they're shopping for an ICHRA plan. There's a whole back-end configuration system, which, it's probably a little bit more intensive of a conversation to take through because there's so much capability in it, but I'll tell you a little bit about it, here. But the first thing I want to show you is sort of what employees ultimately see when they get a chance to come into the system. So let me go ahead and pull that up. So this is just to give you an idea of what the platform looks like. So once it's configured for an employee, the employee logs in, registers their account. There's a couple of ways that can be done. Very similar to enrolling out anything for an OE, whether that's traditional OE that we're going through now, or we discussed earlier a special enrollment period during the year. But employees will come in and they will have a view that looks similar to this, which will allow them to go through and start selecting. They'll be able to see if they have one in the system. Obviously, we have a lot of folks that this applies to, where they have 2025 plan already. So they can see that 2025 plan and an option to renew that plan. They can also, move on. But there's essentially kind of just showing you sort of the user interface and a little bit of a glimpse of the system and capabilities. They can come in here and they manage their profile. They can add dependents. They can shop for traditional insurance. We talked about alternative. They can waive coverage. So this is just showing you some of the options. When they come in and they see the options in here, it'll be clear to them what their current plan is, but also they can look at other plans. They can filter this all by carrier type, metal tier, deductible ranges, overall price ranges, HSA eligibility, et cetera. And then they can go through and shop and make an election. It'll tell them if they're what they're spending. This is the employer contribution available. This is what is being spent, and this is what is going to be needed in this case through a payroll deduction. So this is just some images. I don't have the browser coming up for me at the moment, maybe because I'm on this video, but we can do a demo with anyone who's interested, certainly at any time. But it gives you an idea that employees come in, they get to see everything available to them in their market. It's based on their zip code, their dependents, they get to know what their contribution is, et cetera, and then they can go ahead and make an election. Once they do that, they're able to go in, either you or depending on how the employer's been set up, can go into the 𝗵𝗫𝗄ly ICHRAos system, which IAD is rolling out through the Align process and can support these cases, but you can see the enrollments, what's been elected. We can set up direct payment methods that you can pay for the plans with the carriers, because individual plans are different than a group plan and a group build. Each plan is paid for individually if you're not already familiar with that process. So we have an automated process for generating payment, both debit cards and ACH bank accounts that are in the benefit of the employee's name, or for FBO accounts for the benefit of the employee, where their contributions get loaded and then paid to a carrier for the premium. And we have a whole process for managing that on the back end. So I'll give you a quick idea of what that looks like. Any questions on the employee experience or how that works while I'm getting this to come up that we can answer?
The only question that we have, well, we have a couple. First one is, what is the minimum employer contribution?
If the employer is not 50 plus or an applicable large employer, then technically it could be $1. You can have an ICHRA, like a $1 ICHRA in theory, that just would allow for tax advantage. We haven't seen that necessarily in that literal terms, but we have seen smaller employers under 50 do $50, $100 type of contributions to be able to give something to their employees, and that money becomes tax advantage under the ICHRA.
The reason for that, Mike, is if the employer gives employees affordable coverage under 50 employees, it's blowing up any subsidy. So what a lot of employers do is say, what we want to do is take advantage of the subsidy. So if I give employees affordable coverage, then when they go to buy a plan on exchange, they have to tell the exchange that they're getting money from the employer and the subsidy goes away. Now,
Yep.
so they want to preserve that. On the other end, they may have higher compensated employees that wouldn't get any subsidy. So they want to be able to have them buy insurance pre-tax. So what they do is they create a $1 ICHRA. So they create the ICHRA itself. And for those who are not eligible subsidy, they give a bonus that they then take that bonus and buy individual insurance through payroll deduction pre-tax. So they take taxable money, income, and turn it into pre-tax and ICHRA expense. So that is one way to preserve the getting of the subsidy for those who are eligible, while giving the ability for highly compensated people to buy insurance pre-tax.
Yeah.
That's the game that's generally played, actually.
Great. Yeah, perfect. That's exactly right. Okay, so I was able to pull up something here. I'm going to go ahead and kind of take you through this. So this is just to give you an idea. Once an order comes in, you have this dashboard that's available, to you to see. This is for one of our demo employers here, but you can see orders that come in, what's flagged as new. Here it automatically will default to new. You'll get a notification for any new orders, 5 p.m. daily. An email goes out if you're. Most of our brokers and partners are in the system every day, all throughout the day, or someone on the team is, but you're not going to miss something because you'll get notifications. When you can see all of the members here, et cetera, and what's been ordered, et cetera. The quick view here is, if I look at the details of this employer, this is kind of like, where they're set up. You initially set up an employer. You can see here that this employer also has alternative health plans, which is the sharing plans we talked about. There's 2 vendors that cover the country that we've partnered with to make this available. It's one called Sedera and one called Zion. But you can elect those in here. You can see all of your members and the status of where they are. So these are a lot of test users. Obviously, this is a demo account, but you can see that someone's completed the process, and this will take you to their order. An order is essentially an election that's being made, what plan they elected. If someone's pending, so you can manage this. You can see employees that are terminated, that are off a plan, et cetera. There's configuration across this without getting too overwhelming here, but we talked about contributions and contribution strategies. You can have all kinds of contribution strategies, flat dollars amounts for certain populations. You can do age rated is the most popular because that's how the markets are priced. So as each age goes up, the contribution goes up, but you take the same dollar pool and just remix it across your population rather than flat contribution strategies, which typically are used in group. So that creates more equity in the plan so that employees that are older are going to get more money because their plan's going to be more expensive, and vice versa, employees that are younger are going to get less money, but it's using the same pool of dollars and just reallocating it. But you can do that. We brand it so you can upload an employer's logo, and when they log in, the employees will see the branding. We handle compliance documents. They're required, just like having wrap documents and 𝗍 documents for a traditional plan. They're same thing. It holds true for an ICHRA. We do have a law firm that can produce those for you and your clients out of I think it's less than $300 for a complete set of documents. That's the most popular choice that people use, and then it's produced, and those documents get loaded in here and visible. And then there's some things you can do here around seeing payment history, reporting, understanding all the different transactions and everything else, so you kind of know all the time what's happening with an account. Was the premium paid? If not, what's going on. So you're really able to manage everything. This is also something we can provide as a service. So not to sit here and some of you on the phone are like, well, I don't have a staff or ability to do all these things. That's fine. We have the ability to provide this as a service, and we can talk about that and how we in IAD can support you through that process. But trying to really just give you an idea of the capabilities of the system. We've got some robust reporting, including payroll deduction reports, where someone can come in and get a report that breaks down what's been purchased, and be able to use this for payroll deductions. You can do quoting in the system. We talked about the plan document creation earlier. So in the absence of more time or more dedicated process that's specific to questions you might have, anyone on the call, which we're happy to do, I just wanted to give you a quick idea of how the system is set up and what you can do on the front end, which is configuring and managing your employer groups, and on the other side, what those employee experiences look like. So I'm going to go ahead and close that out and go back to the PowerPoint we were in earlier, and second here, and then we can wrap up and get to any additional questions and conversation. If we look into sort of the future, something that's been increasing in demand is we're going to be introducing a few things into the platform as we get through the end of this year and into the Q1 of next year, which is one, as you move to an ICHRA, we talked about this earlier, the personal choice of major medical coverage. What it's opening up is this demand from employees and the workforce to say, I want to have more flexibility to control other things in my health and wellness journey, right? Joe talked about this earlier, being able to pick proactive or predictive care, being able to go to a specific type of gym or functional fitness area that isn't covered by traditional insurance, but is available. So we're adding a personalized health and wellness marketplace where we have curated vendors and relationships, and that'll be coming in Q1 2026, and you can make available to your groups. And then we're getting more and more as more and more larger employers move to ICHRA strategies. They want to have integrations with their payroll and HR systems. So we'll have over 240 integrations available in the beginning of next year with pretty every major payroll and HR system you can think of. So that's coming. And then we're working right now on how to support employees as they think about more choices, right? And because those choices are very personal to them and their family and their situation and their goals, and it's more than just health insurance, because my choice of a health insurance and is not technically mutually exclusive from the fact that I have other financial debts or obligations in my life, and that money can be repurposed for other things potentially if I save. those kinds of things become very real in this world. And so we're working on everything AI today seems to be growing. That's scary for many, but it's a huge opportunity as well. So we are working on AI-enabled employee support and recommendations where based on the inputs and the information they share, the system will automatically recommend plans, plan choices, other coverages and care that'll help support the broker or the enroller in the process by allowing it to go through all these various pieces of information very quickly and very dynamically. Talked about the integrations that's coming, and now we can spend some time taking any additional questions and or just having some conversation around topics that are on anyone's mind.
Okay, so we do have a few more questions. One is that you mentioned earlier something about, and I'm not sure what they mean, about 150 tax break for employer. Was that what you said? Like 100?
Oh, I think it was the example where, yeah, so what I think what this is referring to, I believe, would be, okay, yeah, here. So, oops. So I think it's probably referring to this right here where it's at $150. So what happens is
Okay.
in this example, the employer there's a plan that's 750 in the traditional group model. Employer is going to commit 600 or contribute 600. The employee is responsible. This is sort of a forced responsibility in this model, right? It's 750.
Mhm.
There's no choice here. The employee is going to have to pick up that 150 regardless. But in this example, by moving to an ICHRA, the employee takes the same 600 and finds coverage and even savings in this example, and never has to go in the pocket for the 150. That 150 stays essentially, that would have been a payroll deduction. Now that 150 stays available to them for out-of-pocket expenses or other things that they need it for. So I think that's maybe where that question was coming from. And if I'm mistaken on that, then I'm happy to talk about something else. But that's really what that.
Nope. That one, yes, she said that was her
Okay.
question. Wonderful. And then we had another question. Can this work for an employer who has one employee? So I know that there isn't a minimum employee amount for ICHRA overall, right? As long as they have one W-2 employee, but the minimum class sizes are going to apply. Am I correct with that if they're also offering the traditional plan? Because you can do both.
Yeah, I
Um,
mean, if you're a single employee, I don't think you're going to have a class issue there, obviously.
yeah,
But we have
Yeah.
lots of groups that are single employees, I
yeah,
guess is
there's
the short
no
answer.
there's no restrictions if you have less than 10. You just
Wonderful.
can't create, like if you have a 200 person group, you can't go and segment out a group of less than 10.
Fantastic. And the next question is typically who manages the employer portal, the employer or the agent?
Both are possible, but generally it's the broker or the agent.
Right, because you can send reporting or you can send the quotes out of the system to the employer.
Yeah, I mean, the system allows you as the agent to do the brokering, to do the things that an agent needs to do. That's really what it's built for. However, oftentimes what actually employers often want, and then agents work with the brokers on is, I mean, the employers on is they want access to, for example, see the payments reporting. They want to be able to manage or view and make sure terminations are submitted in the system, or new hires are added. Those types of things, right? So there's a collaboration that often happens, but in most cases, it's the agent or the broker that's doing the real administration, and that's why there's an administration fee that you charge for this, and so forth.
Wonderful. And feel free, we've got a couple more minutes. If anyone has any other last minute questions, please put them in. I know we had one earlier that was asking about marketing or how to market it, cold call. I think that's probably part of another bigger conversation, but I don't know if you have a minute to kind of throw some ideas out there since you're our subject matter experts on it.
I have an opinion on it. I think that, an employer's fiduciary responsibility to the employees. As soon as the employers start asking the employees to pay more and more and more and more, they have somewhat of a fiduciary responsibility to check out the options. So my campaign is, there's a new tax law out there. By saying tax law, you get the CEO and the CFO start paying attention, pay attention. They could probably save your employee money in health insurance. And with the pain being high, you're going to assume that the current broker didn't show them the ICHRA option or the combination of ICHRA with health sharing or whatever. So therefore, you're really appealing to the person that says, hey, my position is a new tax law has happened. It could save your more employees money. You may not have seen it. And it doesn't hurt to take a check, take a look. There is no pain in Mr. Employer taking a look. I could tell you, I've had situations where employers have fired their brokers. I had one specifically, I'll name it. They had a 29% increase. They increased the premium on January 1st. They heard about ICHRA in February. And this was like an 80-person group. While we're on the phone, the employer was so mad that the current broker didn't show him the ICHRA option that he had to tell the employees to pay more money. He put us on hold, says, give me a few minutes, put me on hold, put us on hold while we're presenting the ICHRA and showing them the savings. He came back on like 2 minutes later, he says, I called my other broker and I fired my other broker. He said, let's go. He was so pissed off. So there's enough of that out there that a CEO or CFO or HR person does not like the idea that they had to ask the employees for more money on January 1st. And they wish they had seen an alternative that would have prevented them from having to go through the pain of communicating the bad news to all their employees. I make it a very binary thing. As of January 1st, is that employee going to be making less money than December 31st because you've asked them to increase their employee contribution for health insurance? I put it in those terms. I'm not asking you to contribute more for health insurance. I'm asking you to take a reduction in your pay because of this. And so that's a different way to really phrase it. Are you asking your employees to take a pay cut as of January 1st?
Absolutely. And I know we didn't touch on it today, but we will in future demos, is that the presentation that you give to the employer that shows them the savings, so that, it's not a fit for everybody like anything, but for those that it is, they can actually see what those amounts will be from what you put together in your presentation for them.
Right.
And we will touch on that at another time.
Savings by person. Make it real money to these people. Make it real.
It's very real. And we do the quoting tools that we do have, which we didn't go into today. You're correct. I mean, we can do that as a separate session, or certainly with folks that are, have cases, and then getting very specific. But, we can show examples certainly. And I gave an excerpt of it earlier. It's very meaningful, oftentimes. And, putting it in the terms that Joe said, which is very real to the individual, has an impact. It basically sells itself to anyone who actually cares. Like, I mean, unless the employer is going to be super selfish, they're going to want to make a change. I think the other thing I would add to this is I don't know obviously we don't know everybody on the call, and everybody has slightly different, market focus and so on and so forth. But at some point when you're looking at a case, and you're discussing the renewal of that case, you're looking at the options. And the obvious one is always the existing model, renew the group plan, and look at alternatives, other carriers, reshifting plan design, whatever it is. I think the thing that we see very successful for folks is incorporating the ICHRA, even if you're not sure it is the right strategy, more from the standpoint of being a good advisor to the employer and saying, I'm going to show you all of the options that seem possible, and let's see what the math tells us, right? To the point that Joe's making. And then you look at the renewals and you look at some of the alternatives, and you say, hey, there's this thing called ICHRA, and what it does is, and you can explain it, and then you show them that. And what happens a lot of times, the employer, if they're not already aware, raises their hand and says, I want that. And the risk of not doing it is that someone else will, because right now it's become so popular that there's another broker knocking on the door. And unfortunately, it's just the reality of the world, right? And they're going to come in and say, have you looked at the ICHRA? And by being proactive, not only will you help, but you can help yourselves and your firm by, cutting off the competitive risk that someone else is going to pull the rug out. So we're seeing that as a very popular strategy, and we're seeing that work, and we have the tools and support to help you with that, and we're certainly happy to talk about it.
Wonderful. Thank you. And some of these questions I'm going to just glaze over for the respect of everybody's time. If it's anything about charges, I will reach out to everybody after today's webinar, or people can reach out to me if you're watching the recording, and we can discuss those more in depth. We will be we're working on some ICHRA presentations that you can potentially use for marketing things. I encourage you, there's a ton of resources out there on ICHRA. If you want to do a little research on it yourself while you're waiting for everything to roll out. And then I did have one question in here to pop out, is it true that ICHRA is available in all states, including Washington State? It's
Yep.
all 50 states, right?
Yeah, all 50.
Yeah, there's no state restrictions. There are variations by state on costs and other factors, right? That's very true in terms of the individual markets, but no restrictions by state. There's some states that have incentives that are probably good to know about, and we can talk about offline. Like, for example, Indiana offers a tax credit in addition to any other savings for every person that goes on to an ICHRA from a traditional plan. I believe it's $400, or at least it was this past year. I think it's staying the same. So there's some interesting things out there that are available as far as that goes.
Wonderful. And then there was another question. Do we have to sign up each employee on the exchange? These are all off exchange plans, so you would not be using the exchange to enroll them. And again, someone asked about a step-by-step guide on setting up an ICHRA. We will be presenting or sending out some presentations and some additional materials as we launch the product. Again, this is the IAD Align ICHRA OS product that we're launching today. So much more information will be coming out. We'll have different sessions that we'll be doing as we progress. And I think that is the last question for today. Thank you everyone for attending, and thank you to Michael, Joe, and Sherry for being on with us. We really appreciate it and look forward to our next sessions.
Yes, thank you, everyone.
Thank you, Tammy.
Thank
Appreciate it.
you,
Thank you
everyone.
all.
Have a
Thank
great
you.
day.
Bye.
Bye-bye.